Hello, my name is Tamika Holliday. I'll be your guide today as we spend time exploring the intersections of intimate partner violence, substance use, and child removal. We'll be analyzing a case scenario with experts in the field and sharing best practices for working with cases with multiple barriers. Mr. and Mrs. Lopez have been married for 7 years and have a beautiful daughter, Rosa. Mr. Lopez drinks and uses cocaine daily. He and Mom occasionally smoke marijuana together. Mrs. Lopez occasionally smokes marijuana but does not use any other drugs. Mr. Lopez has become increasingly violent, and Rosa called the police because her dad was drunk and choking her mother. The police arrested Mr. Lopez and reported child abuse to DCBS, which triggers an investigation. Because of Mom's positive marijuana screening, the 3 children are placed in out-of-home care. Mom is working through her case plan to get kids back. Mom is not ready to leave the relationship with Mr. Lopez. He is currently living at a family member's house, separated from Mrs. Lopez and the children as the investigation continues. What are your initial concerns for the Lopez family?
My initial concerns about the Lopez family are that the children have been removed from the home while an investigation is going on. My concern around that is oftentimes the length of time it takes to complete an investigation, why the separation between parent and child took place in the first place. But ultimately, my main concern is trying to limit the time that those kids are away from their parent. I think another one of my concerns would have to be why Mom would even be tested for the use of anything. If the call came in that Dad was inebriated and was hurting his partner, that doesn't have anything to do with Mom using. There's a presumption there that somehow the entire family is morally bereft and using drugs, because that's really what it comes down to. That's why those issues even come up, because the moral implications that are attached to addiction. Whether it's marijuana or anything else is almost irrelevant, although I think we can all kind of agree that we tend to classify drugs as not so serious on up to very serious. But ultimately my big question is, why was Mom even why is Mom having to submit a drug screen at all? Doesn't make sense. And working in shelter when we are fielding crisis calls, our objective is to screen people in, not screen people out. It's possible that when we cast these wide nets as looking for reasons to remove children, we should be looking for reasons to keep children in the home and not necessarily looking for reasons to remove children from the home. It completely changes the perspective on what does occasional marijuana use look like. Are we really looking at the amount of marijuana that was in the bloodstream at the time and really kind of trying to equate that to how much somebody might be using on a daily basis? We're not. We're just looking for the positive screen. We're just looking for the dirty house. We're just looking for the trash that hasn't been taken out in a long time, so that somehow equates to some parenting skill or some safety issue that the kids are having to endure in this home. Sure, because I believe that the cabinet's main function is the safety of the children and the safety of the home, and I completely understand that. The downside with that is you go into it looking for reasons to remove children instead of looking for reasons to keep them in. But in the rigor of the day, in the rigor of the moment, and the high emotionality that's going on, I think oftentimes in an effort to save these kids, we have a tendency to broadsword the situation and just say, okay, remove until we get an investigation done. It makes everybody feel comfortable. It lets everybody sleep at night, that they know at least the kids are under their control. I wouldn't even say safe, but under their decision-making control at that point.
And with my specialty being children, my initial concerns for the Lopez family is what is going on with the children. As adults, it seems people taking care of that case immediately, either the father's drug use or screening Mom and giving a case plan. but who is connecting with the kids to make sure they feel safe and they understand what is going on in their home from a very child-centered perspective. I think sometimes we give more information to children than they need. On the other hand, I think sometimes we tend to think that we have to talk down to kids to understand what they're going through. So just making sure someone is present for them. In the initial steps of the investigation, I would like them to see, to check in with where the kids are, what they do know and what they may not know, the feelings that they have about the situation, and how they connect with their mom or the non-offending parent in this scenario. As we know about children and their resiliency skills, their attachment or connection to their non-offending parent can be one of the strongest factors in the outcomes for them. Without knowing too much about the background of the Lopez family, in being asked about possible placement options, if they were to stay with their mom, what support systems would surround her for success? Outside of mom, what family members would be available, what safe family members would be available, and the connections that they have with the kids. And then after that, possible foster care, but understanding that, again, kids who have a connection to individuals would seem to be the first place to start. Consistency can be really important for kids so that they know what to expect.
I think my initial concerns for the Lopez family initially center around mom, right, and really determining what her current level of safety is. I have some pretty significant concerns just about the lethality of Mr. Lopez's abuse, given that he was found attempting to strangle his wife. So that's a pretty significant lethality indicator for ongoing interpersonal violence. So initially making sure that mom is physically safe and that she doesn't need any significant medical care. If depending on what kind of violence has been occurring in that home and how severe that trauma has been to mom, has she had other periods of loss of consciousness? Does she need to be evaluated by another medical team? I also obviously have concerns about Mr. Lopez's ongoing substance use. I think, you know, he obviously, his violence has been increasing over the years as reported by the child. You know, ongoing and increasing use of alcohol and cocaine, obviously that doesn't cause someone to be violent, but it does increase the potential for lethality in that relationship. So I do think that Mr. Lopez obviously needs a very good substance use disorder assessment. Because he's using alcohol, he's probably going to need access to some detox services as well. And then other initial concerns for that family really center around the children. Obviously, growing up in a home where there's ongoing violence is an issue, and the toxic stress of being in that environment, but the added toxic stress is being removed from the only parents that they know. Mom obviously does have a positive screen for marijuana, and that's an issue because that's an illicit substance. But we don't know that use is frequent. What we do know is that it's occasional. We don't have any indication that she's using any other substance that would be considered a highly lethal substance or that would cause other greater concerns. So I do think that we need to take that into consideration. Those children have been removed. That's incredibly traumatic if they're in an out-of-home placement, and it sounds like they are. I think there's going to be some real increased stress on the children's part about where is mom and is she safe as well, and I think that needs to be taken into consideration.
What barriers would the Lopez family have to meeting their case plan?
There are a lot of barriers that the Lopez family can have in completing this case plan. It really depends on where they are economically in their life, where they, you know, whether or not dad's the sole breadwinner in the family, whether or not they have vehicles, whether or not they have access to some of the services that they're being told they have to complete. You know, when people are asked to remove themselves from a situation, or mom, you need to, if you want to keep your kids, you need to go to shelter, which we see quite a bit. You know, there's a lot of upheaval there. You know, it's a much bigger ask than I think people are giving credit for. And so Ultimately the barriers, they're of course individual to every single family, but they're so vast, and some of them seem, especially at the time when people are dealing with trauma in that moment, seem insurmountable. So that, to try and see it through the lens of a trauma victim, it might help to alleviate some of those response items that might end up on a case plan, response to the actual call itself versus here's why we're coming. If I were recommending a case plan for the Lopez family, I would recommend a case plan that focuses on why the call happened. The call happened initially because father was hurting mom, and father was inebriated, and the children believed that that was part of the picture. So let's focus the case plan there. Ergo, mom doesn't need a whole large case plan of the things that she needs to complete because she has been seen as not being able to protect the children. According to the scenario, was that the kids were scared for mom. They were not scared for themselves. So we need to have the case plan be focused on why the call was made in the first place.
Barriers I would see to the Lopez family completing their case plan would be the understanding of what systems are in place for them, the knowledge of the individuals working with them in the issues that are going on with the family, especially when you talk about domestic violence, which can be an intense and multi-dynamic issue. And it's an issue that not many people have a lot of education on. The other biggest barrier is what access to services there are. If children are removed and they're put into foster care, does that foster care family have the ability to provide the support that they need? Being placed in that foster care family could feel safe because they're not in a home where their violence is occurring, but do they have the counselors? Do they have the ability to get the therapists, the ability to get them even to appointments? And the same for the mom herself. Or did she have to leave the home? Does she have accessibility to housing? Or did we set her up for now to have less resources than she had even being in an unsafe environment?
So I think potential barriers for any family that's seeking any kind of substance use services is actually finding a treatment program that will allow an entire family to come to treatment. Again, Mrs. Lopez is going to need a thorough substance use assessment. If it is found that she has a level of disorder that necessitates residential treatment, there are very few treatment facilities that allow women to bring their children with them to treatment. So I think just accessing a family substance abuse treatment is going to be incredibly hard for them. I also think it could be a huge barrier based on Mrs. Lopez's experiences of other mental health symptoms. If she has some co-occurring depression and PTSD, we know that sometimes it's incredibly hard for those people to engage in treatment and to stick with treatment. I also think Mr. Lopez may have a hard time finding treatment as well. It's incredibly difficult if this family doesn't have access to Medicaid. If they're employed and they have private insurance, they're not going to be able to afford co-pays for treatment that's necessary for someone who's using alcohol and cocaine daily, and to be able to have the level of care that's really needed for this family to enter recovery.
What recommendations would you have for service providers working with the Lopez family?
Reunification is absolutely possible for this family. I believe that when most people are talking about families that are working with the cabinet, working with DCBS, working case plans, the ultimate goal is always reunification. I think we need to work towards that direction. So really, the resolutions are limitless. It really depends on what the family members are willing to do to make reunification happen. And I think it's our job as service providers, it's the cabinet's job as case managers to see to it that we are making those steps possible. We don't want to set people up for failure. If we say in one conversation, our ultimate goal is reunification, and then on the other hand, make these goals, impossible for somebody to do, we're just setting them up for failure. So I think ultimately it's limitless in resolution. Whatever resolutions need to happen, we need to make it possible for those family members to be able to pull that off.
What the non-offending parent, or Mrs. Lopez in this case, would need She would need a strong case plan and a strong safety plan, and recognizing that those may be two separate things. A strength-based, trauma-informed case plan and safety plan would be the number one thing towards reconciliation, but also understanding it may not be easily reconciled either, because some of the accountability will be placed on Mrs. Lopez, and there needs to be a balance of accountability and engagement.
So as far as substance abuse treatment options for the Lopez family, Mr. Lopez, based on his daily use of alcohol, would definitely need a detox service, most likely, because detoxing from alcohol is potentially fatal. Mrs. Lopez, based on the family history, is only smoking marijuana occasionally. She absolutely would definitely qualify for a substance use assessment. You know, one of the things that we know about women is that it's very typical for their substance use to start as a result of a partner. They don't always start using as young as males do, and they typically begin use because of coercion and force by a partner who is also using. So it's also very likely that if she's only smoking occasionally, she does not have a severe substance use disorder, that Mrs. Lopez's use may stop on its own once she's away from Mr. Lopez. And what we may learn from that assessment is that the primary disorder may not be necessarily the substance use disorder, but could be some other co-occurring mental health issues as a result of experiencing any kind of childhood trauma, as well as the trauma that she sustained from Mr. Lopez. And I think a very good place to start for Mrs. Lopez would be a baseline urine drug screen. Marijuana is very easy to monitor in someone's system. She presents as someone who's incredibly willing to work this case plan. She's already working the case plan. We'll know, within a few days if those levels are going down, and we'll be able to tell if she's continuing to use marijuana and if the substance is actually the root problem. And so one of the options, I think, is to return the children immediately if they have been removed, and let's put in some extra home support. And I think one of the benefits of doing some in-home services is that we actually get to see mom manage real life stress and get to see her enact coping skills in her everyday life. You know, I work in residential treatment. I understand that people in residential treatment can remain sober and lead a life of recovery while they're in residential treatment. And that is a little bit easier because they don't have the normal stresses of everyday life. There's no reason that this family couldn't stay in their normal real life now, that dad is out of the home because clearly that's a safety concern, but we get to see mom really practice with those children. We can really truly look at the bond and the attachment that the children have to mom, and if that's been harmed in any way, we'll be able to see that in a real setting in their home environment versus a very kind of sterile environment in a treatment setting or an outpatient office with a clinician.
The issues surrounding the Lopez family are complicated and deserve a thorough assessment. Our experts have offered their thoughts about the family, and now, what are your thoughts surrounding the Lopez family? Engage in a discussion with your training group about your observations. Lopez family recommendations. Support reunification whenever possible. Make the case plan goals achievable. Set families up for success. Create strong case plans and safety plans that are strengths-based and trauma-informed. Aim for a glance of accountability and engagement. Assist clients in obtaining a thorough substance use assessment by trained clinicians and refer to appropriate level of care. Offer in-home services for non-offending parent when possible to decrease barriers to services.